Hi guys, welcome back to my channel. My name is Laurie. If you are new here, I am a family nurse practitioner and I currently work in the urgent care space. So on this day of work, I am busy trying to formulate my progress notes. This was actually around 8:45 in the morning, and believe it or not, we open at 8 a.m. and I have already saw 6 patients. So 3 of those patients were COVID. 2 were traveling, so they needed a COVID test to travel. The other one had symptoms. Anytime patient comes to the urgent care for COVID testing, whether they have symptoms or not, it doesn't take really a long time to see those patients. The other 3, one came in with a rash and one patient needed an x-ray, and then one had like UTI symptoms. Now, I do want to say that in the urgent care space, most urgent care does have a x-ray on site. Do not be afraid to use your x-ray machine, even if the patient says that they did not injure themselves. There's a lot of things that you can tell doing a simple x-ray in your clinic. I am going to do a video about when is it necessary to do an x-ray or not. I think that would be a very good teaching point. The patient that came in with the rash, that is what we are going to talk about today. So I had a 65-year-old female who presented with complaint of a rash for the past 9 days. She stated that she noticed the rash on her legs, and then she noticed that the rash was on her arms. She complained of itching, denies any known bites or changes in lotion or soap, and she also denied introducing any new food or medication. She stated that she did use over-the-counter hydrocortisone cream that has not been helping her. She said she then reached out to a friend of hers, and the friend sent her in a Medrol dose pack. She took the Medrol dose pack for the entire time, and the rash seems to be worse. So during my assessment, I noticed that the rash had patches with also some raised blisters. I asked the patient, has she known of coming in contact with poison ivy, oak, or sumac? Some patient will come into the clinic and say, I was exposed by sumac, because I had a patient that did that the other day. It's the same as your poison ivy contact dermatitis. She said no, because some patients don't really know that they came in contact with any of, with these. I asked her, were you outside in the yard doing any yard work? And then she was like, oh yeah, I was helping my neighbor moving some bushes and planting flowers. So I did diagnose the patient with poison ivy dermatitis. Poison ivy dermatitis typically presents as an acute, intensely pruritic eruption characterized by erythematous plaques, vesicles, and bullae. And I did also notice she did have a little bit of rash on her face. So let's talk about treatment for poison ivy dermatitis. For mild dermatitis, that means that the poison ivy only is affecting a limited part of the body. You do want to use a super high potency topical corticosteroid, such as clobetasol. So you want to do clobetasol cream 0.05% for twice a day. Now, per up to date, the high potency creams don't really have an effect once you start seeing the blistering on the patient. Once you get into the severe dermatitis, which the patient has the rash, multiple other parts of the body, including the face, you want to go ahead and give the patient prednisone taper. Just remember that once you prescribe prednisone for more than 5 days, it needs to be tapered. If the course of the prednisone is only 5 days, you don't have to taper it. So in this case, you can do 60 milligram times 3 days, 40 milligram times 3 days, 20 milligram times 3 days, and make sure you're tapering the prednisone that way. And also, your max prednisone for the day should not be more than 60 milligram. Also, per up to date, a shorter course of systemic corticosteroids, such as the Medrol dose pack, a 6-day course, can sometimes lead to rebound dermatitis. And remember, I told you guys that my patient did receive a Medrol dose pack in the beginning when she first developed this rash. That is it for this video. Don't forget to like, comment, and subscribe to the channel, and I will definitely catch you guys up in my next one. Bye, guys.